adults, teens, and even babies are struggling with opioid withdrawal. There's a federal law to help these newborns get immediate care, but 11Alive's news senior investigative reporter Rebecca Lindstrom discovered it may also be hurting innocent families. She joins us to explain right now.
We are talking about CAPTA, Child Abuse Prevention and Treatment Act, and this takes a lot of different forms over the years, but about a decade ago, the government mandated hospitals report any child born or affected or experiencing withdrawal from a substance, legal or illegal, to be reported. Now, the feds left it to the states to really define what that meant. Some say Georgia's definition goes too far, or at least hospitals' reporting programs do.
We have states who have no idea what substance affected mean, providers who don't either. On the ground level, many folks don't even know this is the policy. It's just kind of what happens. And so we need to give more thought to how we're implementing this, because the truth is, many times we think we're helping, but we're actually hurting.
That was Dr. Stephen Patrick, a professor and chair of Emory's Health Policy Management. He says the whole point is to connect moms and their newborns to drug treatment and the necessary medical care. But along the way, we're reporting moms who may have taken a THC gummy or smoked pot days before giving birth to manage maybe pain or nausea. I even heard from one woman who tested positive after eating a poppy seed bagel. She even gave the receipt to the hospital, but still she was reported and had to go months with supervised visits before this was all sorted out.
Wow. How many reports are we talking about here?
Well, these reports really did spike in 2020, and that is when, according to an open records request, we saw about 3,500 cases statewide. DFAC says that it has worked to educate hospitals on its policy and what they're really trying to capture with these reports. And they say that has led reports to drop, as you can see, almost in half, but still more than half of those cases, 2/3, end up unsubstantiated once that investigation is performed. That means that there was no maltreatment or risk to the child. Now, we talked with one mom who lost custody of her son for almost a year trying to fight these allegations. Now, her case is a bit more complicated. There was a serious allegation of abuse in 2014 involving another child, but the reality is DFACS wouldn't have even known she had another kid if it weren't for this test. And the medication she was taking, they were all prescribed by her doctor.
What am I supposed to do? Am I supposed to suffer? Because if I do take something that's needed to help me feel better, knowing that they may knock on my door and say, no, we're taking your child again because you took a medication that was prescribed to you because you had something done to you that caused you a lot of pain, or you were in pain due to your medical conditions.
I want to note, by law, hospitals are required to report that positive drug test, but there is nothing in state law that in many of these cases requires them to take that test in the first place. We surveyed metro hospitals and, we wanted to know why and when they were testing these moms and infants, and only Northeast Georgia Health System would detail its policy. Advocates for civil rights and pregnant moms say that lack of transparency, or perhaps even lack of a policy, can lead to bias.
Yeah, I was going to ask you that. Yeah, what would give them any indication to even do it in the first place?
And so, when a mom comes in, if she self-reports that maybe she has taken a medication, or they go ahead and they do a urine drug screen and she tests positive, then they say they automatically go through and they test the baby to see what happens. But sometimes some are arguing it's overreach.
Seems like HIPAA would come into play here, but all right, we're going to hear more from you a little bit later on. Rebecca's going to give us a full report in the 12:30 streaming. She's going to look deeper into this issue. We want to hear about it. Thanks so much, Rebecca, for joining us. Really appreciate that. And if you have a tip for our investigators, you can look into it by calling us at 404-873-9111 or email us at investigates@11alive.com.